Hello everyone. So just starting. So before that, let me just check, am I audible? Is the screen clear so that we can start this session? So let me have a check. Okay. So today's session is most important histology MCQ session targeting for the NEET PG 2022 examination. So just having a check. So yes, I am audible. Okay, I am audible and everything is fine. So my dear aspirants, what we will do today, I will discuss most important histological images and important questions regarding histology part, so that you are not going to miss any of the histology MCQs. Okay, so let's start with the session. So I think everything is fine. I am audible, and meanwhile the aspirants are joining. Let me give you a quick review about the platform and about myself, Dr. Monalisa. Okay, so yes, my dear aspirants, yeah. So I have got a total of 9 years of teaching experience for the past 9 years for various competitive examination, and I have done my MD Anatomy from Armed Force Medical College, Pune, and I am anatomy educator on the Unacademy platform. Let's talk about the special class features. What are the benefits of joining free special session? So when you are being a part of free special session, you can have an interactive session with the educators. That means learners and the educators can interact. Polls are conducted, you can participate in the polls, and it will be highly beneficial for you. Raise your hands, get your doubts clear, write itself in the session. Never ever miss a session. Once a session is finished, PDF notes can be downloaded. Never ever miss a session. What does that mean? For example, if you start seeing the session, you can follow the educator on the Unacademy app, and thereafter you will always get a notification regarding any of the session taken by that educator. So anytime, anywhere, read from the top educators of Unacademy platform. So it is important that before proceeding, I should also give you information of the free special class of mine which is upcoming. So high yield anatomy MCQ session for the NEET PG 2022 examination is being taken by me on the 30th of Sunday, January. So just on 30th January, that is Sunday. 2 sessions I will take, 1 PM and 2 PM. So do join live, and the aspirants who are watching the session for the first time, they have to download the Unacademy app and they have to use the code ANAT10 so that they can be present live for my session. So I'd also like to, I'm just enlarging it, so you can have the whole detail of January free tests. Okay, so this is targeting for the medical PG examination. My dear aspirants, all of you can participate in this free test, and you can get enrolled in this test by using the code ANAT10. So just use this code ANAT10 and get enrolled, and whole timetable is shared by you. Now, my dear aspirants, I would also like to tell about the plus subscription. When I am talking about plus subscription, that means the entire 19 subject will be completed in a very systematic way. You can study from India's top educators, and you can also compete in live tests and quizzes, which will be highly beneficial for you. Study on the device of your choice, and assess to 25,000 MCQs. All these MCQs are clinical MCQs. Good evening, Ansari. This is clinical MCQs of all 19 subjects, which is based on recent pattern of examination, which will help you to secure a better rank in the competitive exam. And soon you will be provided with the printed notes of Unacademy if you are going to take the subscription of 1 year or more. My dear aspirants, I would also like to tell you about Iconic subscription, where the merging of Bladder and Unacademy has been done. So already talked about the benefits of Unacademy Plus course. I would like to talk about the benefits of Bladder. Clinical integrated essentials, video lectures from the Dream Team, QBank 3, rapid revision, snapshots and treasure dream notes of the Bladder. So these are added on benefits if you are going to take the Iconic subscription. So you can avail an opportunity of 10% discount by using the extra discount by using the code ANAT10. Ayushman Patra, good evening dear. Congratulations to the toppers who have secured a very nice marks in the competitive exam of FMG December session 2021. So I wish them good luck so that they can crack their NEET PG exam in the first attempt. Now, this is just a slide which is showing you the pricing detail or a comparison done between the NEET PG and Iconic subscription, which will help you to decide which subscription you should take. The aspirants who are targeting next NEET PG should definitely go for iconic subscription. Use my code and add 10 and get an extra discount of 10%. First and second year aspirants should go for 3 or 4 years of subscription. Highly updated QBank is there on the platform of Unacademy. So have an access to all these QBanks and solve all these MCQs, and just use this code and add 10 for taking the subscription and getting an additional discount of 10%. Detailed explanation is also provided to each and every MCQs. Now, I am very glad to share the Republic Day special offer, that is if you are going to take the subscription of 1 year or more of Unacademy plus 6-month free extension is given to you. So plus 6-month free extension will be provided to you, and by using the code and add 10 an extra discount of 10%. So just grab this opportunity. So yes, before starting exactly the session, I want to show you this slide because this is very important. You must want to know that which sessions are right now going on the platform of Unacademy. Focus, FMG comprehensive batch for FMG 2022, and also NEET PG batch is going on. So MCQ batch. So these two batches are currently running on the platform of Unacademy Plus. So you can just grab this opportunity, use my code for getting extra 10% discount. So let's start with the session now. Okay, so let's start with the session now. Okay, so my dear aspirants, I will start with the first MCQ of today's session. Okay. So yes, this is the first MCQ. I would like to read it for you. A patient presented with acute abdominal pain. On clinical examination, the patient underwent cholecystectomy. All the best to everyone, those who are present live. So you have to tell me which type of epithelium, the specimen which is taken, and if we go for the histological slide, which type of epithelium is present in the structure taken out. Squamous epithelium, simple columnar epithelium, and simple columnar epithelium with brush border, cuboidal with stereocilia. According to you, which is the best correct answer? Your time starts now. Mark the correct answer, whether it is A, B, C, D. Okay, so your time starts now. Please mark the correct answer. 30 seconds will be provided to you, otherwise I will come up with the explanation of this MCQ. So my dear aspirants, okay, Amol has given the answer. What about others? Okay, Akshay Kumar, C. So Akshay Kumar is absolutely right. Simple columnar epithelium with brush border is the correct answer. Okay, so yes, okay, so it's not just simple columnar epithelium, Amol, it's also having the microvilli, which is giving the arrangement of the microvilli is irregular, so it is called as brush border epithelium. So the correct answer will be gallbladder. What do you mean by the operation cholecystectomy? So cholecystectomy is performed, that means gallbladder has been removed. That means gallbladder has been removed, and we know that lining epithelium of gallbladder is simple columnar epithelium with brush border. So C is the correct answer. Okay, now, so firstly I would like to explain, and I will also give you certain key points about the histology of gallbladder. Okay, so yes, Alam Ansari, okay, let me explain it, don't worry, I am coming up with the explanation. So if you see this diagram, actually this is a histological diagram showing H&E stain slide of the gallbladder, and this is the how the slide, this is also showing you the low power view, and in that box the high power view of gallbladder. To better understand this, I would like to enlarge. What I would like to do, I like to enlarge this diagram. Okay, so is it okay? I am enlarging this diagram and let me explain it. So my dear aspirants, if we talk about the gallbladder slide, if I talk about gallbladder slide, the key feature is that the gallbladder has got a lining epithelium of, the gallbladder slide has got a lining epithelium of simple columnar epithelium. So see here, simple columnar epithelium has been written here. And but if you will see the enlarged view or the high power view, you can see it is also having microvilli. The arrangement of microvilli in the epithelium of the gallbladder is irregular. How is it? It is irregular. So the arrangement of microvilli is irregular. So a proper term which is used is brush border. So this will be brush border. Now, my dear aspirants, other than that, what you can see, there is lamina propria, the next layer of the mucosa, but the mucosa, muscularis mucosa, actually this is also important for you to know that which two layer is absent in gallbladder. Muscularis mucosa and submucosa layer is absent, and then we have got the muscularis externa layer, and the outer side will be having the adventitia or the serosa layer. So also what you can appreciate, the mucosal foldings are irregularly folded. Okay, irregular arrangement is there of the mucosa. So let me write the histological features of gallbladder. Okay, so my dear aspirants, I would also like to highlight one more point about the gallbladder is that it is also important that you should also know the other example where we have got columnar epithelium with brush border. Okay, so right off, let's talk about the histology of gallbladder. So it is having columnar epithelium. It is having columnar epithelium with brush border. The meaning of brush border is irregular microvilli. It is having irregular microvilli. Now, it is also important for all of you to know that where we have got more examples of irregular microvilli and brush border columnar epithelium, brush border epithelium, actually PCT, okay, PCT. So, yes, PCT is the proximal convoluted tubule is also having brush border epithelium. And it is also important for you to know that when the microvilli arrangement, in case of intestine, if we take an example of intestine, the arrangement of microvilli is regular, and when the arrangement of microvilli is regular, it is called as striated border. It is called as striated border. So, got it? Now, other important point of view about the histological features of gallbladder is that lining epithelium, which is already known to you, it is simple columnar epithelium with irregular arrangement of microvilli, that is the brush border. Other than that, it is having absence of, so this is one of the important point. Other than that, the next layer will be lamina propria. So, lamina propria. And in this case, the lamina propria, if you will see, is having more of elastic fibers. So, it will have elastic fibers, it will have few blood vessels inside it. It will also have the blood vessels running, and there will be absence of. So, we know that lining epithelium, lamina propria and muscularis mucosa, these are the three layers of mucosa. So, there will be absence of muscularis mucosae, that is the third layer of the mucosa, and the submucosa layer. So, this is also very important for your MCQ. So, please note down that it is also very important for your MCQ that there is absence of two layer. The absence of two layer is that there is absence of muscularis mucosa and submucosa layer in case of gallbladder. The outer layer will be adventitia layer, or it can be serosa. So, adventitia layer where it is directly lying in the fossa region, gallbladder fossa in the liver, and where it is not lying in the gallbladder fossa, it is covered by serosa, that is it is having a covering of mesothelium. Okay. So, other than that, in between adventitia and that of mucosa layer, in between there is the another layer which I left out, that is muscularis externa. So, it is also having muscularis externa layer. In the outermost layer, there is adventitia, there will be blood vessel, nerves and lymphatics running. So, is it okay everyone? Have you understood? Can we move on to the next MCQ, that is MCQ number 2? Is it okay? So, let's move on to the second MCQ. So, yes. Identify the histological slide. So, take your time, identify the histological slide. All the best to everyone, all the best. Okay, all the best to everyone. Identify the histological slide. So, yes, identify the histological slide. Your time starts now. Please mark the correct answer. Whether it is a slide of spleen, lymph node, ileum or thymus. So, the histological image has been shown to you and you have to identify this histological slide. So, your time starts now. Please mark the correct answer. Let me keep my mobile here so that I can see your images or can see your messages also. So, okay, 30 seconds will be provided, otherwise I will come up with the right answer. Identify the histological slide. Which slide is this? Any idea which histological slide is this? So, my dear aspirant, the correct answer is this is the slide of lymph node. This is the slide of lymph node. So, why it is a slide of lymph node? Let me just enlarge it and explain to you. So this is exactly the histological image which has been shown to you. So here we can identify that this is the slide of lymph node, because here we can see it is having the outer fibrous capsule. From the fibrous capsule, trabecules are given inside, and this structure which you are seeing is the structure having lymphatic aggregation. So this is called as GC. Let me write it. This is GC. What do you mean by GC? Germinal center. So this is lymphatic aggregation. This is the lymphatic aggregation which is seen in the cortex of, this part is the cortex area, this part is the cortex area of the lymph node, and this is the paracortex area, this is paracortex area, and the lower part, this is the medulla. So inside the medulla we have got medullary medullary sinusites, and the major contribution of the lymph node, the major structure which is lying in the lymph node is lymphatic aggregation. Okay, so here you can see that also the other important point, one more point which will help you to target the correct answer. Let me use okay, so I am just highlighting it with light green color, this area. Actually this space which you are seeing lying just below the fibrous capsule, this is called as subcapsular space. What is that space? This space is called as subcapsular sinus. So actually subcapsular sinus is the space which is lying just below the capsule of the lymph node, and this space is present in the histological slide of lymph node. So medullary cord, sinuses. So in the medulla we have got blood vessels residing, and the major content of the cortex of lymph node is the lymphatic aggregation. The center of this, if you will see the center of this is called as germinal center. Why it is called as germinal center? Because it is having the more lighter stain, because it is containing immature lymphatic aggregation. Okay, immature lymphatic aggregation. So this is the slide of lymph node. Now, so this exactly we have talked about the lymph node, and we have seen the characteristic feature for identification of the slide of lymph node. Now, other than that, the other structures, so why not ileum? Because ileum is not the correct answer, because in case of the slide of small intestine, there will be the lining epithelium will be simple columnar, also ileum में pierce patches होंगे, villi होगा. It is not a slide of thymus because there is no hazel corpulses. It is not a slide of spleen because spleen will have red pulp and that of white pulp both. So this is a slide of lymph node. Is it okay everyone? This is a slide of lymph node. So let's move on to the next MCQ, that is MCQ number 3. Identify the histological slide. Okay, anyone want me to repeat? Please be free to ask any doubt. Okay, agar kuch bhi, if you are not understanding any of the point, my dear aspirants, please tell me to repeat it or explain it once more. Okay, so be free to ask. So let's move on to the next, that is the third one, identify the histological slide. Okay, because in the histology session taken by me before also I have explained few of the histological slide. So this is a repetition kind of thing, but anyone is not understanding anything or have been present for the session for the first time, they can ask me doubts. So whether this is a slide of fibro cartilage, whether it is a slide of hyaline cartilage, whether it is a slide of elastic cartilage or articular cartilage. So according to you, which is the best answer? Question number 3, mark the correct answer. So your time starts now. Please mark the correct answer. This is a slide of. Okay, so my dear aspirants, I would like to give the answer. This is a slide of elastic cartilage. This is a slide of elastic cartilage. So we have got elastic cartilage as the correct answer. The next point will be how I am understanding that this is a slide of elastic cartilage. So let me explain the same slide once more to you. So just taking slightly enlarged view of it. So why this is a slide of elastic cartilage? The first appearance which you see, when you see this slide, the first appearance which is shown to your eyes is that it is a slide which is brightly stained. It's very bright. It is brightly stained, and in between running are so in between what happens? Let me use pink color only. These fibers, can you see here in between? So it's also pink, so I will use with blue color only. So these are the elastic fibers. So this slide is having so many of elastic fibers running. Okay, Okay, this rounded structure which you are seeing is so many of the chondrocytes. So this is a slide which is having many chondrocytes, the cells of the cartilage. This is having many elastic fibers running. So only the entire image of the slide is bright pinkish in color, and this is the outermost perichondrium. What is it? This is the outermost perichondrium. So this is the perichondrium. So this is a slide of elastic cartilage having an outer covering of perichondrium, and it is having large number of chondrocytes, and in between the chondrocytes, what lies? In between the chondrocytes there is brightly stained pinkish color elastic fibers. What is running? Elastic fibers. So a slide which is having many elastic fibers, so many chondrocytes stuffed together, not arranged exactly in an isogenic group, but it is stuffed together tightly. Dense number of chondrocyte is there, perichondrium is there, and elastic fibers are there. So this becomes a slide of elastic cartilage. So this defines that this is a slide of elastic cartilage. Now the other one, so this was the right answer. Then now one more important point is lying there. So why other options are not correct? So let me come up with this. Why the other option? Fibrocartilage is not the correct answer, because fibrocartilage is having absence of perichondrium. Absence of perichondrium. So here there is perichondrium present, and fibrocartilage will have more of collagen fibers. Hyaline cartilage is not the right answer, because the appearance will be more of basophilic, and hyaline cartilage, the cartilages or chondrocytes are arranged in a group that is called as isogenic group, that is also called as cell nest. Articular cartilage is not also the right answer, because here also perichondrium is absent. Perichondrium is absent. So we have got C as the correct answer. Now my dear aspirants, I would also like to show you other slides. So why I am showing you the other slides? So I want to explain all the cartilages here, important one which is always asked in the examination. To make you understand the elastic cartilage slide, I have taken this labeled histological slide which will help you to understand the details of elastic cartilage. So let me slightly enlarge this. So here you can see this is the elastic cartilage slide. And the important features of elastic cartilage slide is that it is having perichondrium. The perichondrium outer part is called as fibrous layer, and the perichondrium is again made of two layers. Outer is fibrous and the inner is chondrogenic layer. Actually in the chondrogenic layer you have got small immature chondrocytes. So immature chondrocytes are called as chondroblast. So chondrogenic part, if we talk about chondrogenic part ki baat kare, if we talk about chondrogenic part of the perichondrium, it will have immature chondrocyte that is called as chondroblast. Later you can see chondrocyte which is lying in a space called lacuna. In between the chondrocyte we have got many elastic fibers. So this is exactly what was asked in the MCQ. So these are the identifying features of the slide of elastic cartilage. Is it clear everyone? Are you understanding? Give me a thumbs up. Now let's talk about hyaline cartilage. So the other cartilage which is also asked so many times in the examination is the hyaline cartilage slide. So the key features of hyaline cartilage slide is shown here. In the hyaline cartilage, what you can see, the arrangement of chondrocytes are more in a group. See here, this is a group which you are seeing. This is also a group. If I highlight this, okay, see here, this is also, if we talk about hyaline cartilage. So see here, these are arranged in isogenic group. These groups are called as cell nest. What is it called as? This is called as cell nest. Perichondrium is present. Again the perichondrium will have chondrogenic as the inner layer and fibrous layer on the outer side. And also if you will see, the matrix lying very close to the cell nest is more of darker stain as compared to the matrix lying in between the cell nest, that is called as interterritorial matrix. So in case of hyaline cartilage, interterritorial matrix is lighter stain in comparison to the territorial matrix which is more darkly stained. Okay. So this is exactly the appearance, and already if you want to revise much detail of the cartilage, you can see my cartilage session which I have taken on the future Dr. Unacademy. So you can just see that session. Now I would also like to show you the fibrocartilage slide. So fibrocartilage slide is again very important because of its identification point which I want to tell. This is a slide of fibrocartilage. The first appearance which you see in this slide is that there is no perichondrium. There is no outer covering which is the perichondrium. So, there is no perichondrium, and you can see the appearance of the slide is wavy. So, there is a wavy appearance. And why there is a wavy appearance? Because fibrocartilage is having so many of collagen fibers. It is having many collagen fibers. Okay, which type of collagen fibers? Type 1 collagen fibers. Okay, so a slide which is wavy in appearance, giving a feather like appearance, and it is having a less number of chondrocytes. So, also the number of chondrocytes are less. So, chondrocyte residing in the lacuna and their number is less. They are less in number, not arranged in a group. They have got more of collagen fibers, so it is appearing wavy. So, we have done with this. So, can we move on to the next MCQ, that is MCQ number 4. So, yes, your time starts now. Please mark the correct answer. Stave cells are seen in liver, in spleen, in pancreas or in gallbladder. Stave cells are seen in which of the following? Liver, spleen, pancreas and gallbladder. So, what is the correct answer? Your time starts. Stave cells are seen in which of the following slide? Liver, spleen, pancreas and gallbladder. According to you, which is the correct one? Please mark the correct answer. So, yes, I got an answer from Murukeshan B. Okay, B. So, I got an answer as B. So, stave cells are present in spleen. So, yes, absolutely correct answer. Yes, spleen is the correct answer. Spleen is absolutely correct answer. So, actually stave cells, I would like to show you a diagram of stave cells also here. So, you can see here actually in the red pulp. So, stave cells are actually present in the red pulp area of spleen. So, in the spleen we have got splenic sinusites. So, what do you mean by splenic sinusites? What do you mean by the term sinusites? Means the capillaries which is having discontinuous epithelium and discontinuous basement membrane. The shape of splenic sinusites is spindle shape. So, see here you can see this is the splenic sinusites which is spindle shape. This is just to make you understand, and actually this sinusoid is also having macrophages, plasma cells, and it is having a covering of, and you can see here reticular fibers are whole covering it, reticular fibers which is forming the stroma, which is giving structural support to that of the spleen, and this is also forming the stroma or connective tissue framework of the spleen. So, this whole reticular fibers are encircling the splenic sinusites, and this whole appearance is like a barrel. The shape of the splenic sinusites covered by reticular fibers is arrangement is called as barrel shaped structure, and this structure is called as stave cells which is present in the spleen. The function of stave cells is to engulf the old worn out RBCs. So, let us move on to the next, that is question number 5th. Heart palate contains. So, what is the correct answer? This was asked in 2019. Heart palate contains keratinized submucosa, minor salivary glands, keratinized absent submucosa, minor salivary glands, non-keratinized submucosa, minor salivary gland, or D option. Absent submucosa, non-keratinized or minor salivary glands. So, you can see 4 options are there and you have to mark the correct answer. Hard palate contains. Hard palate contains which of the following is the correct answer? Hard palate. So, yes, your time starts now. Mark the correct answer. Okay, whether it is right or wrong, please attempt it. Okay, it doesn't matter whether it is right or wrong. So, what is the histological feature for hard palate? If I have to choose the correct answer, I will go with question number 5th. I will go with keratinized epithelium, some mucosa present and minor salivary gland. So A option is correct. So which option is correct? A option is correct. Okay. It is having keratinized epithelium, it is having some mucosa layer and it is also having minor salivary gland. So yes, my dear aspirants, I would like to show you this diagram where you can, this was a question asked in 2019 NEET PG examination. So if we talk about the palate, hard palate epithelium, it is keratinized type. It is also having the presence of some mucosa and minor salivary gland. Actually, when we are talking about the mucosa layer of the hard palate, it is bounded with that of the bone over which it is lining. So can you see, this is the epithelium. So if you will see, this is the, firstly write down, this is the slide of hard palate. Here this EP, what do you mean by EP? EP means epithelium, and you can clearly see here, if this is the epithelium, it is multiple layered. Can you see here? It is multiple layer and outermost part is also having keratinization. So this is the keratin deposit. So it is having, the epithelium is keratinized epithelium. Keratinized epithelium. It is also having lamina propria, and the S here stands for submucosa layer. Submucosa layer, and it is lying adjacent to the piece of bone. So the correct answer will be A. Keratinized epithelium, submucosa and minor salivary glands are present. Let's move on to the next, that is question number 6. Identify the histological slide, whether it is a slide of appendix, whether it is a slide of colon, whether it is a slide of duodenum or gallbladder. So options are appendix, colon, duodenum, gallbladder. Okay. So if you want, I will slightly enlarge this diagram. So see here, I have enlarged this diagram so that you can identify this, because one key feature is shown, one key feature is present here which will help you to understand that what is the correct answer. Now you can give me the answer. So just see the slide once more, 30 seconds I will give you for solving this MCQ. Okay, my dear aspirants, now again options are appendix, colon, duodenum, gallbladder. So according to you, which is the correct answer? So the correct answer here is, identify the histological slide, the correct answer here is colon. So why I am telling colon is the correct answer? Because if you will see this diagram, what you can appreciate here, you can appreciate here the presence of this whitish structure which is not taken stain, and this is goblet cell. So a slide having many goblet cells. So the characteristic feature for identification is that there is goblet cell here, many goblet cells. So in this slide there is absence of villi, there is no villi, villi is present in small intestine, and there is many goblet cells. So the whole slide is having many goblet cells. So this will help us for the correct answer, that is colon. So this becomes that a slide having many goblet cells, absence of villi, is definitely a slide of large intestine. This is a slide of large intestine. The other option which is provided, so see here, the other option which was provided in this MCQ, why not appendix? Because appendix will definitely have a part of lumen and will have many lymphoid aggregations, will have many lymph nodes or lymphoid aggregations surrounding it. Okay. Duodenum not, because duodenum will definitely have Brunner's gland which was not present. Why not gallbladder? Gallbladder is not having so many of goblet cells, and in gallbladder the lining epithelium must be brush border, which is also not shown here. Brush border is not there, so it is not a slide of gallbladder. So definitely this becomes a slide of colon. So let me show you a better picture of better understanding of the slide of colon. So if I enlarge it, so definitely we will go with each slide which was asked in the MCQ. So this is a slide of colon or large intestine. Okay. So see here, columnar epithelium is there, and what I told you, the characteristic feature has been shown. The characteristic feature which you are seeing is the goblet cell. So there was presence of many goblet cells. So see here, all these structures which I am highlighting in green color, these all structures which you are seeing is the goblet cells. So many goblet cells are there. All these structures are goblet cells. So many goblet cells are there. Also we can see intestinal gland, lymphatic nodules is the part of it, but the characteristic feature is absence of villi and goblet cells are present many, that means it is a slide of large intestine or colon. Got it? Now, again when you see, this is the next diagram which I am showing you, next histological diagram. This is a slide of duodenum. So, let us understand why this is a slide of duodenum. So, the key feature for identifying the slide of duodenum, the first thing is that this is having villi. Okay. So, the slide of duodenum will have the villi, long villi, lining epithelium, simple columnar lamina propria, and this gland. So, can you see many glands? So, what are these? These are the glands which are seen, and these are duodenal glands. What are these? These are duodenal glands, which is also called as duodenal glands are also. So, there will be presence of duodenal glands in the submucosa. The duodenal glands are also called as Brunner's gland. So, the characteristic feature for the identification of duodenum will be a slide showing villi, okay, having duodenal gland or Brunner's gland, and also the layers is, this is the muscular layer. These are the muscularis externa and having nerve plexus. So, all the layers of GI tract has been shown. Small intestine. So, this is a slide of small intestine jahan villi dikhega. If a slide is showing villi along with lining epithelium, so generally get cleared when high power is there, but this is a slide having villi and Brunner's gland. So, this is a slide of duodenum. Now, the next slide which I want you to explain here is of ileum. So, when you see the slide of ileum, you can identify that here also villi is there, but along with villi, the characteristic feature for identification is that, can you see here, what are these rounded structures? So many lymphatic aggregations. So, there will be many lymphatic aggregations, and the collection of lymphatic nodule is called as Pierce patches. A slide which is having villi, having all layers of GI tract, and also having collection of large number of lymphatic nodule, that is called as Pierce patches, makes it that this is a slide of ileum. Now, if we see the slide of gallbladder, so one more time, we have already explained about gallbladder, so that would be not much problematic. It is having lining epithelium, simple columnar epithelium, mucosal fold, there will be brush border epithelium, absence of, so you can see mucosa is thrown into folds, there will be absence of submucosa and muscularis mucosa. So, actually for the gallbladder we have already talked in the previous class, question. So, we will quickly move on with the question number 7th. Is it okay everyone? Let us move on to the question number 7th. Have you understood? Everyone, have you understood question number 6th? Murucation. Okay. So, yes, let us move on to the next question number 7. Newly erupted teeth is covered by, please mark the correct answer. Okay, newly erupted teeth is covered by, okay, thank you dear, is covered by, newly erupted teeth is covered by perikymata, Nismath membrane, fibrous tissue, all of the above. Okay, so I will again provide you with the 30 seconds and you have to give the right answer. So, in this case the correct answer is Nismath's membrane, Okay, the newly erupted teeth is covered by a membrane. The name of that membrane is Nismath's membrane, or reduced, it is also called as reduced enamel epithelium. So, actually primary enamel cuticle is the name, Nismath's membrane or reduced enamel epithelium. Actually, this is again the MCQ for the NEET PG 20 examinations. So, yes, I got a correct answer from Chandni, yes. So, primary enamel cuticle is the other name of Nismath's membrane, which is also called as reduced enamel epithelium. Actually, these are produced by the amyloblast and it is covering the newly erupted tooth. So, actually with the process of chewing the food and subsequently it will be cleaned up. So, the tissue is primarily basal lamina and it is worn out by the process of cleaning and mastication or chewing process. Okay, so here I want to show you this diagram. This is the erupted enamel, and a newly erupted enamel is covered by reduced enamel epithelium, which is also called as nasmite membrane. So we have got reduced enamel, primary cuticle, primary enamel cuticle, or nasmite membrane as the correct answer. So okay, let's move on to the next question, number 8. Most common zone of okay. So yes, most common zone of BHP, benign hypertrophy of prostate. Most common zone of benign hypertrophy of prostate. So yes, please mark the correct answer. I will wait for 30 seconds and then I will ask you the correct answer. Please mark the correct answer. So whether it is anterior zone, central zone, peripheral zone, or transition zone. So mark the correct answer. Your time starts now. Okay, I got an answer from Chandini, transition zone. So Chandni, you are absolutely correct. Chandni, you are absolutely correct. Yes, transition zone is correct. Can you tell me the most common zone for the cancers? So benign hypertrophy of prostate, benign hypertrophy of the prostate gland is transition zone is the common zone. And when I talk about prostatic cancer, which is the right answer? For prostatic cancer, it is which zone? Peripheral zone, peripheral zone. So my dear aspirants, peripheral zone. Yes, I got an answer. So all of you are absolutely right. Transitional zone is the correct answer. My dear aspirants, I also want to explain the zonal anatomy of the prostate gland. So let's start with that. See here. Firstly, let me talk about the peripheral zone. Okay, now central zone. Okay, actually in case of prostate gland, we have got peripheral zone, we have got central zone, we have got transitional zone, and we have got fibromuscular part, fibromuscular anterior part. Fibromuscular, actually this is the anterior part of the prostate gland. Okay, yes, Chandni, you are absolutely right. Peripheral zone is the area which is mainly the most common zone for the prostatic cancer. You are absolutely right, Chandni. Now, so actually the peripheral zone is surrounding the distal part of urethra, and it is the part of the prostate gland which is directly lying beneath the layer of fibrous capsule. So approximately 70 to 80% of all the prostate cancers are arising from this zone. So this is most important zone for the prostatic cancer. 70 to 80% of the cancer is found in this zone. Now let's move on to the central zone. Central zone is occupying 20% of the whole area of the prostate gland. But if I talk about the cancer being located in this area, it is only 2.5%. Central zone is that part of the prostate gland which is surrounding which area? Ejaculatory duct. So ejaculatory duct is formed by joining of ductus deferens and that of seminal vesicle. So ampulla of ductus deferens and seminal vesicle, when joins, it is forming ejaculatory duct, and the part of prostate gland which is surrounding the ejaculatory duct is forming the central zone, and 2.5% of the prostatic cancer is arising from it, and it is a more aggressive kind of cancer if it is involving. Why? Because it is lying very close to the vas deferens, and also seminal vesicles can be involved. Now let's talk about transition zone. So the correct answer was transition zone. Transition zone is that part of prostate gland which is surrounding the proximal part of urethra. So it is surrounding proximal urethra. 10 to 20%. How much it is? So 10 to 20% of the prostate cancers arises from transition zone, and it is occupying 5% in the area. Transition zone is occupying 5% of the total area of prostate gland. Okay. And benign hypertrophy is more common. So which is more common in this region? Which structure, which tumor is more common? So benign. So actually benign hypertrophy of prostate is more common in this area. Benign hypertrophy of prostate. So please mark it. benign hypertrophy of prostate is more common in transition zone. Now let's talk about the anterior fibro. So actually anterior fibromuscular zone is devoid of any glandular structure and no cancers arise from this area. So actually it is just composed of muscles and fibrous tissue and no cancers arises from the anterior fibromuscular zone of the prostate gland. Now this is a very beautiful diagram. Means correct. I mean to say that systematically it is very correct to understand the zonal anatomy of prostate gland. So if I enlarge it, you can understand this diagram. So my dear aspirant, please concentrate on this diagram. So what you can see here, this is the peripheral zone. Okay, so this will be the peripheral zone, and if you see the peripheral zone, it is occupying the distal urethra. It is occupying which part of the urethra? You can see here it is occupying this part. So this is the distal urethra part. Okay. Now transition zone, as I told you, जब हम transition zone की बात करते हैं, it is surrounding ejaculatory duct. So transition zone is surrounding the ejaculatory duct, and here you can see the seminal vesicle and ampulla vas deferens together will join to form the ejaculatory duct. So together this structure is ejaculatory duct and transition zone is surrounding the ejaculatory duct. Okay. So now transition zone is more posteriorly. I just got transition zone is surrounding the proximal urethra. It is surrounding the proximal urethra and it is common for the benign hypertrophy of prostate. This is the ejaculatory duct. Please correct it. So this is the ejaculatory duct which is formed by joining of the vas deferens and seminal vesicle, which is having surrounding area here. This area is, let me use another color for this. This area is basically the area of central zone. So ejaculatory duct is actually the area which is surrounding the surrounded by central zone of the prostate. Is it okay? And anterior part, if we talk about anterior part which is devoid of glandular tissue, anterior fibromuscular zone. So this part is actually the part which is devoid of cancer. So anteriorly fibromuscular zone, central zone is surrounding ejaculatory duct, please make it correct. Peripheral zone is surrounding distal. So I will write peripheral zone is surrounding distal urethra, transitional zone is surrounding proximal urethra, central zone is surrounding ejaculatory duct. So is it clear to everyone? Zonal anatomy. Can everyone has clear with the zonal anatomy? Can we proceed to next MCQ? Okay, so let's proceed with the question number 9. Brunner's gland is present. Brunner's gland is present in which of the following? So if you have listened to my session, you will mark it correct. Okay, abhi just so before few MCQs, I have just explained about Brunner's gland and I have shown you the location also. So you tell me in which layer of duodenum is it the Brunner's gland is located? In the mucosa layer of the duodenum, in the muscularis externa, or the submucosa layer of duodenum? So according to you, which is the best correct answer for question number 9th? Okay, I am getting correct answer from Murukeshan. Murukeshan, you are absolutely right. Murukeshan is absolutely right, and it is the submucosa layer of the duodenum. Absolutely correct. So in the submucosa layer of the duodenum, we have got the Brunner's gland. Absolutely correct, my dear. Absolutely correct. Okay. So I just want to show you the slide of duodenum where you can appreciate the layers of the duodenum. So we know that duodenum has got villi, which is exactly shown in this diagram. So here we can see here these are all villi, which is having a covering of columnar epithelium, having a striated border, that is microvilli is regularly arranged. Okay, in the submucosa layer. So if I talk about the submucosa layer, this layer is the submucosa layer, and in the submucosa layer very clearly you can see, if I highlight also this glands you can see here. So this is the Brunner's gland which is present in the submucosa layer. This is present in the submucosa layer. Next layer, so innermost layer is the mucosa. So this is the innermost layer, then is the submucosa layer. if I move it like this. So see here, in case of duodenum, innermost layer is mucosa. So then we have got the muscularis externa and the outermost layer is the serosa. That means if we proceed from inside to outside, mucosa, submucosa, muscularis externa and that of serosa layer. So absolutely correct. Let's move on to the next, that is question number. Let's move on to the next, question number 10th. Cell lining the common bile duct. Cell lining common bile duct, whether it is stratified columnar epithelium, whether it is stratified squamous epithelium, whether it is simple cuboidal, whether it is simple columnar epithelium. Cell lining common bile duct. Question number 10th. Cell lining common bile duct. Bile duct is lined by which of the following epithelium? Bile duct is lined by which of the following epithelium? So yes, otherwise I will come up with the answer. The correct answer is D, simple columnar epithelium. Actually, if we talk about the lining epithelium, so actually intrahepatic ducts, also cystic duct and also common bile duct. All these ducts will have the same lining epithelium, that is tall columnar epithelium. Tall columnar epithelium means simple columnar epithelium. So we will pick which as the correct answer. So that is the reason we have got D as the correct answer. Okay, D as the correct answer. Now, so let's move on to the next, that is question number 11. Type of structure shown in the histological slide is present in which of the following structure? Intervertebral disc, articular disc, epiphyseal plate or pinna. So my dear aspirants, firstly you have to identify the histological slide and then you have to mark the right answer, which is the correct example of the presence of this histological slide. So means you have to identify which slide is this and then you have to know the example of that slide. A, B, C, D. What is the correct answer, my dear aspirants? Please mark the correct answer. Okay, so the correct answer is epiphyseal plate. Now let me explain it, why it is epiphyseal plate. So let me just highlight this diagram. When I am enlarging this diagram, you can clearly see, okay, the same slide is here. So let me use this one. So see here we can identify the cartilage. Why? So you can see here, this is a group of, what are these? These are all chondrocytes. Okay, chondrocytes are arranged in group. So in this slide, let me use, if these are all chondrocytes located in the lacunae. So the chondrocytes, if you will see, the arrangement of chondrocytes are in the group. So what is this called as? Just now I have explained, then this becomes this is isogenic group of chondrocytes, and isogenic group of chondrocytes are present in the cells of hyaline cartilage. They are present in the slide of hyaline cartilage, and also we can appreciate this is the perichondrium layer. This is the perichondrium layer. Okay, this is the perichondrium layer. This is the fibrous part of the perichondrium layer, that is A, and this is the chondrogenic layer of the perichondrium, chondrogenic layer. Okay, the whole is homogeneous appearance of the matrix. So this becomes the slide of hyaline cartilage. So next important point is to know. So yes, absolutely right. Murcation is absolutely right. Yes, cell nest. So this is the also called as cell nest or isogenic group that is present in hyaline cartilage. So this is other diagram which will help you to understand. These are all cell nest. So okay, this is from the D4 is histology, and you can understand that cell nest is the present in case of hyaline cartilage. This is the perichondrium which you are seeing. This is the F for fibrous layer. This is the C for chondrogenic layer. and also, so actually this is taken an example of the trachea. So actually this is a slide of trachea where you can see the part of hyaline cartilage has been shown. So yes, now let's move on to the MCQ. So now the next point is to understand which is an example of hyaline cartilage. So intervertebral disc is the wrong answer. Why? Because intervertebral disc is an example of fibrocartilage. It's an example of fibrocartilage. Intervertebral disc contains which cartilage? It contains fibrocartilage, so it is wrong. Articular disc also contains fibrocartilage, so it is wrong. Epiphyseal plate contains hyaline cartilage, so it is the correct answer. Epiphyseal plate is made of hyaline cartilage, so that is the reason that epiphyseal plate is the correct answer. Now pinna is also wrong. Why? Because pinna is containing elastic cartilage. It is containing elastic cartilage. So we have got C as the correct answer. So everyone, have you understood this? Can we proceed to next MCQ? Is the concept cleared? Murkeshan, Shreyash, Chandni. Okay, can we move on to the next MCQ? Okay, so let's move on to the next MCQ, that is MCQ number 12. Okay, let's move on to the next one. True statement regarding red, okay dear. So true statement regarding red pulp of the spleen. True statement regarding red pulp of the spleen. So red pulp of the spleen is containing perisinusoidal macrophages, periarterial lymphatic sheath, B cell containing lymphoid follicle, or none of the above. So which is the correct one? Which is the correct one? Red pulp of the spleen contains. So again 30 seconds I will wait, otherwise I will give the answer. So when we are, so actually we know that spleen is having, so actually the correct answer is A, perisinusoidal macrophages. So when I am talking about white pulp of the spleen and when I am talking about red pulp of the spleen, what is the difference? When we are talking about white pulp of the spleen, it is mainly consist of lymphocytes aggregation. It is consist of lymphoid aggregation, lymphatic nodule, that means it contains lymphatic nodules. Okay. In case of red pulp, we have got splenic sinusites, which will also contain macrophages, plasma cells, and supporting network in between, and the supporting network is formed by reticular fibers. Now other important point is that periarterial lymphatic sheath, what do you mean by this? So that is clear that perisinusoidal macrophages will ultimately present in, will be clearly present in which part? Will be clearly present in the red pulp. So that is the correct answer. Now periarterial lymphatic sheath is wrong. Why? Because actually white pulp is containing lymphatic aggregation, and this lymphatic aggregation which is directly surrounding the central artery. So my dear aspirants, in the spleen there is entry of trabecular artery. Trabecular artery when goes inside the cortex part, which goes and reaches the white pulp of the spleen, there it is it is named as central artery, and the lymphatic aggregation which is exactly lying in the vicinity of the central artery is called as periarterial lymphatic sheath. That means it is also present in white pulp. B and lymphatic follicle is definitely present in white pulp, so we have got A as the correct answer. So the concept will be more clear if I show you the diagram. So if I show you the diagram, so let's move on in seeing the diagram. So see here, let me slightly enlarge this diagram. So this is a slide of spleen. See here, this is a slide of spleen. In this we have got the outermost fibrous capsule. This is fibrous capsule. What are these? What are these which is going inside? These are all. What are these? These are all. These are all trabeculae. What are these? These are all trabeculae. So through trabeculae the central artery is traversing, and here you can see one of the central artery. So see here, this is central artery, this is central artery, this is central artery, this is central artery. So your doubt must be there that central artery is called center, but it is not central. So see here, This is white pulp of the spleen, this is lymphatic aggregation, this is lymphatic aggregation, this is lymphatic aggregation. That means these are white pulp of the spleen. The rest part is all red pulp of the spleen. Now, the location of central artery, which has to be in center because of the name, but exactly it is not in the center. Why? Because when through the trabecular artery, the central artery is entering, soon it is surrounded by, soon the central artery is surrounded by lymphatic aggregation, and this lymphatic aggregation will push the central artery to which position? Eccentric position. So, it is actually eccentric position. Actually, this is the characteristic feature, identifying point for the identification of spleen slide, that the central artery location in the lymphatic aggregation will be eccentric, and the lymphatic aggregation which is lying just close to the central artery is called as PALS, P-A-L-S, periarterial lymphatic sheath. So, please write down this. Central artery is surrounded by lymphatic aggregation, Central artery is surrounded by lymphatic aggregation, pushing the central artery to which position? Eccentric position, pushing it to eccentric position, and the lymphatic aggregates, basically this lymphatic aggregates, which is basically made of more of T lymphocytes is called as PALS, P-A-L-S, it is called as PALS. What is PALS? What do you mean by the full form of PAL? Periarterial lymphatic sheath, it is called as periarterial lymphatic sheath. Got it, everyone? Is the concept clear, everyone? Murucation? Yes. So, let's move on to the next, that is question number 13. Phylum terminal is chiefly composed of, pia mater, dura mater, fibrous tissue, neural tissue. What is the correct answer? Phylum terminal is chiefly composed of pia mater, dura mater, fibrous tissue, neural tissue. Okay, Shri Rangraj has joined. Okay, Shri, pia mater. Okay. So, the correct answer is fibrous tissue, and why I will tell you. Actually, yes, you are partially correct. Actually, phylum terminal is modification of pia mater. Phylum terminal is modification of pia mater. Okay, it is modification of pia mater, so you are partially correct. But if I talk about the maximum tissue content, means what it is composed of, please read the MCQ nicely. Phylum terminal is composed of which structure? It is not asked it is a modification of which structure. If the question is asking it is composed of, iska composition, what is its composition, we will go with fibrous tissue as the correct answer. So, here fibrous tissue will become the correct answer. It is modification of pia mater, but its major composition is of fibrous tissue. Got the point? Nitesh? Okay, everyone? Yes, that is also right. It is like we are correct, then also the point is like absolutely correct. The MCQ was to make you confuse only. Phylum terminal, वहाँ पे pia mater is given as an option to make you confuse. Okay, phylum terminal, we know that it is modification of pia mater, but if it is asked composed of composition, then we will go with fibrous tissue as the better option. Got it? Yes. Phylum terminal, what is it? It is a delicate filament, approximate length is 20 centimeters. So, just quickly we will revise the anatomy of phylum terminal. It is composed of two parts, upper and the lower part. The upper part of phylum terminal is approximately 15 centimeters in the length, and it ends at the level of second sacral vertebrae. It is contained within the tubular sheath of dura mater. It is composed within the tubular sheath of dura mater, and it ends at the level of second sacral vertebra. This is the part of upper part. Now, lower part of phylum terminal is called as phylum externum, which is mainly it is closely investigated by adherent to dura, and it is going till the level of first segment of coccyx. So, it is extending till the level of first segment of coccyx bone. It is called as phylum terminal externum. It is approximately 5 centimeters, lying outside dural sheath. Phylum terminal. So, this is the MCQ which has been asked. This was the MCQ which has been asked. It is mainly composed of fibrous tissue. It is mainly composed of fibrous tissue, and it is continuous above with the pia mater. So, both your doubt is clear. Modification, continuation of pia mater, but basically it is composed of fibrous tissue. Adhering to the outer surface, actually it is also containing rudimentary nerves. Which rudimentary nerves it is containing? It is containing second, third coccygeal rudimentary nerve. It also contains rudimentary nerves of second, third coccygeal nerve. Now see here, if I enlarge it, you can see here this thin structure which is moving down. Okay, this is the area where this conus medullaris, if you enlarge this, this is the area where the spinal cord is ending. Can you see here? This is the part where you can say the spinal cord is ending. So, this is the part where spinal cord is ending. Conus medullaris, which is at the level of L1 lumbar vertebra. From here only a line is seen going down. This is phylum terminal. This is phylum terminal. Okay, now let's move on to the next, that is question number 14. Centroacinar cells are present in parotid gland, pancreas, prostate or colon. Centroacinar cells are present in which of the following? Parotid gland, pancreas, prostate or colon. So, Sri Rangraj has given the answer, and the correct answer is pancreas. Pancreas is absolutely correct answer. Yes, absolutely correct answer is pancreas. Centroacinar cell, actually what happens, we know that pancreas is having both endocrine part and exocrine part. It is having both endocrine and exocrine part. Exocrine part is having acinus and endocrine part is having islets of Langerhans. So, now in the exocrine part, which is containing serous acini, what it contains? It contains serous acini. So, generally what happens, the intercalated duct which arises, so intercalated duct will arise from the acinis. So, actually when the duct arises inside the acini, it is called as centroacinar cell, and it is present in case of pancreas. So, see here, this is the diagrammatic representation. This is serous acini. Now, what you can see in this acini, that what you can see, this is centroacinar cell. Actually, this is the duct, this is the most initial part of duct which is lying inside the acini, So, what happens, generally the duct, when we talk about the duct of exocrine structures or exocrine glands or acinis, it arises outside the acini. It arises outside the acini. But if it is arising inside the acini, it is called as centroacinar cell. So, you can see inside the acini. So, for example, if this round, if I take this round globular structure is the acini and this is the duct. So, duct should arise from here like this. If this is a rounded structure, this should arise, the duct should arise like this. But if the duct is going inside, it is arising inside the acini, that part is called as the initial part of the duct as centroacinar cells. Have you understood, everyone? Now, so see here, this is also the histological diagram showing the pancreas, where you can see the nucleus of centroacinar cell lying inside, and this is the duct which is arising. Okay, this is the duct which is arising. So, centroacinar cell is definitely present in the pancreas. It is definitely present in the pancreas. So, actually centroacinar cells are extension of, so if you want to write, you can write centroacinar cells are extensions of intercalated duct into pancreatic acini, inside of the pancreatic acinus. Got it? Got it everyone? This is the definition you can say. So what happens? यहाँ पे क्या होगा? It will be like centroacinar cells will then form intercalated duct, then will form intralobular duct, then it will form lobular duct, then it will form interlobular duct, and then it will form pancreatic duct. So this is how the duct is formed. The most initial part of the duct will be centroacinar, then it will form intercalated duct, then it form intralobar, inside the lobe, then lobar duct, then in between the lobes, and then the main duct, that is the pancreatic duct. Got it everyone? Let's move on to the next. So let's move on to the next one, that is question number 15. Okay. Strongest layer of esophagus. Which is the strongest layer of esophagus? Whether it is mucosa, whether it is submucosa, whether it is muscularis externa, whether it is serosa. Strongest layer of esophagus. According to you, which is the correct answer? Strongest layer of esophagus is mucosa, submucosa, muscularis externa or serosa. So I got an answer from Chauhan. What about others? Salia Chauhan. Okay, Sri Rangraj, mucosa. Okay, so let me explain. Actually, the correct answer is submucosa. So we know that in case of esophagus also, we know that esophagus is a part of GIT. So it is having 4 layers from inside to outside. It is having a mucosa layer, then it is having the submucosa layer, then it is having muscularis externa layer, and the outermost layer is adventitia layer. So actually what happens? This again we know that mucosa will have the epithelium, will have the lamina propria and muscularis mucosae. Now here the epithelium of the esophagus, can anybody tell me what is the epithelium of esophagus? Stratified squamous non-keratinized. The epithelium is stratified squamous non-keratinized epithelium. Okay. Stratified squamous non-keratinized epithelium. When we are talking about the submucosa layer, if I am talking about the submucosa layer, it is the strongest layer. Why? Because it contains it is made of fibroelastic connective tissue. It is made of fibroelastic connective tissues which is strong, and this layer of esophagus, in case of esophageal injury, in case of GIT tract injury, it can be also used as anatomic sutures. It can be used for anatomic sutures because of its strength. So strongest layer, please don't get confused, it is not muscularis externa, but it is the fibroelastic connective tissue layer, that is the submucosa layer of esophagus. Absolutely right, Chauhan. Let's move on to the next, that is question number 16. So I also want to show you this slide of the esophagus, where you can see the esophageal slide, where you can see the whole layers of esophagus. So this layer which you are seeing is stratified squamous non-keratinized epithelium. Non-keratinized epithelium. Okay, now this is the muscularis mucosae layer, this is the lamina propria layer inside, and this is the submucosal gland, or you can say esophageal proper gland, which is lying in the submucosa layer. This is the muscularis layer. This is the muscularis externa layer, and this is submucosa layer is the strongest layer of esophagus, the strongest layer. Done. Let's move on to the next, that is question number 16. All of the following are found in the lungs except which of the following structure is not found in the lungs? Kulczycki cells, brush cells, Clara cells or the Langerhans cells. Which of these cells are not found in case of lungs? Kulczycki cells, brush cells, Clara cells, Langerhans cells. So okay, I got an answer from Sri Rangraj. Sri Rangraj has already given the answer, and my dear Sri, you are absolutely correct. You are absolutely correct. So Langerhans cells are not found in the lung. Actually, Langerhans cells are found in which structure, organ? Can anybody tell me? Langerhans cells are predominantly found in which structure? Langerhans cells are predominantly found in skin. It is predominantly found in the skin, okay, and it is antigen presenting cell. It is an antigen presenting cell. Now, let's talk about the other option. So, the other option is wrong. Why? I will tell you. Okay, so Kulczycki cells, let's talk about Kulczycki cells. So, all other is wrong. So, if we talk about this Kulczycki cells, this is the cells which is also called as neuroendocrine cells, which belongs to the APUD system of the cells, and it is actually important for the secretion of, what does it secrete? It secretes serotonin. Let me write more clearly. It secretes serotonin, and it is found in the walls of lungs. It is found in the lining epithelium of lung. To be more specific, it is found in the lining epithelium of the lung. Now, this is one. The other one which is given is the Clara cells. Clara cells is also found in the lung. Actually, Clara cells, to be more specific, it is called as non-ciliated columnar cells. It is non-ciliated columnar cells. And it is actually found in which part of the lung? It is found in terminal or respiratory bronchioles. And the function of Clara cells, can anybody tell me? The function of Clara cell is it secretes surfactants lipoprotein. What does it secrete? It secretes surfactants, which is called as lipoproteins, type 2 pneumocytes. Now, so these two are, so that means these all structures are present. Only Langerhans cells is not present, so that is the correct answer. What about brush cells? Actually, brush cells is having microvilli, and they will act as microvilli. They will act as a receptor cells. So only Langerhans cells are present in the skin. All other cells are present in the lungs. Let's move on to the next. That is question number 17. All the best. Epithelium lining of lingual surface of epiglottis. Epithelium lining of lingual surface of epiglottis. What is it? It is simple columnar, it is pseudostratified ciliated columnar, it is simple cuboidal, it is stratified squamous epithelium. According to you, which is the correct answer? Epithelial lining of lingual surface of epiglottis. So, your time starts now. Please mark the correct answer. I got an answer from 17D, stratified squamous. Okay, many of you have given, all of you has given Sri Rangaraj, Murukeshan, Chauhan, all of you have given perfectly right answer. It is stratified squamous epithelium, absolutely correct. So, actually when we talk about epiglottis, which is a laryngeal cartilage, it is called as double-edged sword. Why it is called as double-edged sword? Because on its two surfaces, the one which is lying close to the oral aspect will have stratified squamous epithelium, and the one which is lying close to the respiratory tract will have respiratory epithelium, that is pseudostratified columnar epithelium. So, with here lingual surface means close to the tongue aspect. So, tongue aspect ke close mein jo so we know that epiglottis is a flap like structure which is lying on the posterior aspect of tongue. So the part which is lying facing the oral cavity will have stratified squamous epithelium, and the part which is towards the respiratory aspect or a laryngeal aspect, that will have respiratory epithelium, that is pseudo-stratified ciliated columnar epithelium. So see here, I have taken this slide where you can see here, if you want to, I will enlarge it. So you can see here this when you are talking about epiglottis slide. So in case of epiglottis, it will have elastic cartilage. This is one of the key feature, that it will have the elastic cartilage in between. E for epiglottis and E for elastic cartilage, and two epitheliums. Okay. So this is pseudo stratified columnar epithelium. So pseudostratified columnar epithelium, that is similar to respiratory epithelium, close to the laryngeal aspect, close to the oral cavity or the lingual aspect. It will have stratified squamous epithelium. See here, it is multi-layer, so it will have stratified squamous epithelium. So it is also called as double-edged sword. Is it clear? It is also called as double-edged sword. That is the reason. So yes, let's move on to the next, that is question number 18. Space of dyes contains all except. Space of dyes contains all except microvilli, the blood plasma, the Kupffer cells, the hepatic stellate cells. So which of the following structure is not present in space of dyes? Space of dyes contains all except. So I got an answer from Chauhan. What about others? Otherwise I will come up with the explanation. So can anybody tell me space of dyes is present in which structure, which organ? Space of dyes is present in which organ? Space of dyes is present in which organ? The correct answer is Kupffer cell. Space of dyes is present in liver, and it is space of dyes is also called as perisinusoidal. Absolutely correct. Absolutely correct, Murukeshan. Perisinusoidal space. It is also called as perisinusoidal space. So we will come with the, it is present in liver, and it is exactly not inside the sinusoid, it is perisinusoidal. Okay, it is perisinusoidal space. Actually, when we talk about Kupffer cells, it is the correct answer. The reason is that Kupffer cells are present inside the sinusoidal lumen. So it is present inside the sinusoidal lumen, inside sinusoidal lumen. So it is inside the sinusoid lumen. It is inside the sinusoidal lumen, Kupffer cell. Rest all is in the surrounding part. That is called as perisinusoidal space of dyes. So see here, let me show you here. See here, perisinusoidal space or space of dyes is the location in the liver which is lying between the liver cell hepatocytes and sinusoids. Okay. If we talk about the definition of perisinusoidal space, the other name of the perisinusoidal space, that is the part which is lying, that is the space which is lying in between the sinusoids and the hepatocytes. See here, it contains blood plasma. Microvilli of hepatocytes will also extend into this space, and it will allow the protein and other plasma protein from the sinusoids to be absorbed by hepatocytes. So it leads into these structure. Microvilli of hepatocytes is helping the hepatocytes to absorb proteins and plasma components from the space. The perisinusoidal space is also containing hepatic stellate cells. The other name of hepatic stellate cell is Ito cell, which store fat soluble vitamin. To be more specific, it is storing vitamin A. To be more specific, it is storing vitamin A. Fat soluble vitamin is vitamin A. So is the concept clear? Perisinusoidal space. My dear aspirants, is the concept clear? Space of dyes is also called as, okay, space of dyes is also called as perisinusoidal space. It is the space which is lying between the liver. It is the space which is lying between the liver cells and the sinusoids. Microvilli of hepatocyte extends absorbs the protein, absorbs the plasma nutrients. So microvilli is helping the hepatocytes to absorb these structure. It contains blood plasma, space of dyes, and it contains hepatic stellate cell, which is also important for storing fat soluble vitamins A. Okay, so clearly we can see that it is not containing Kupffer cell, which is exactly lying inside the sinusoid, not outside or in the periphery of sinusoids. So see here, this diagram will better make you understand perisinusoidal space of dyes. So here I am highlighting this space. This is the space of dyes. What I have told you, what is this space, where it is located. If I am talking about this space is exactly located in between hepatic cells and sinusoids. So here you can see these are all hepatic cells. Okay, these are all hepatic cells, and here we can see the endothelium of the, we can see the endothelial cells of the sinusoids. So exactly in between these two, space, this space which you are seeing is the space of dyes. So this space between the hepatocytes and sinusoids is the space of dyes, and inside the endothelium, and you can see inside the sinusoids, this is inside the sinusoid. So inside the sinusoids we have got Kupffer cells. Is the concept clear, everyone? Is the concept clear? That Kupffer cells is lying inside the lumen of sinusoids, not outside sinusoid. The space which is lying in between the hepatic cells and sinusoid is the space of dyes containing blood plasma, microvilli of the hepatic cells and hepatocytes, and also is important for absorption of the fat soluble vitamins, vitamin A, ito cells. So got it? Let's move on to next question number 19. Panniculus adiposus is seen in, scrotum, orbit, eyelids or penis. According to you, which is the best correct answer? Panniculus adiposus is seen in which of the following? Your time starts now. Question number 19. So I got an answer from Sri Rangaraj. What about others? Panniculus adiposus is seen in orbit. Okay. So my dear Shri, you are absolutely right. Orbit is having the presence of subcutaneous fat. It is having the presence of subcutaneous fat, and the other name for subcutaneous fat is called as panniculus adiposus. The other name of subcutaneous fat is called as panniculus adiposus. So yes, orbit is containing this fat. Now there are certain places where there is absence of subcutaneous fat. So there is absence of subcutaneous fat, that means panniculus adiposus, and the reason where there is absence of panniculus adiposus is scrotum, penis, eyelids, nipple, areola. External ear also. So these are the position where we have got no fat. Got it, everyone? So this is important for you to revise for your MCQ. Absence of panniculus adiposus occurs at following site. So the name of, can anybody tell me what is the name of muscle which is located in the subcutaneous fat? What is the name of the muscle? Which group of muscle it is called as? We have given the name, a particular name has been given to the muscles which is located in subcutaneous fat. It is called as, yes, absolutely right, Shri. It is called as panniculus carnosus. Absolutely right, panniculus carnosus. Okay, and panniculus carnosus examples. Panniculus carnosus example. Can anybody tell me example of panniculus carnosus muscle? Dartos muscle, muscle in the subcutaneous fat. Platysma muscle, muscle in the subcutaneous fat. Muscles of facial expression present in subcutaneous fat. Palmaris brevis muscle of the upper limb. Palmaris brevis muscle, muscles of face. Dartos muscle. External anal cutis muscle, muscle along the anal aperture. Got it? Absolutely right. Let's move on to the next, that is question number 20th. Okay. So yes, Vasa vasorum includes blood vessels supplying the walls of large blood vessel, blood vessels supplying the nerves, veins accompanying the arteries, veins accompanying the nerves. What is the correct answer? I got an answer from Sri, I got an answer from Murkeshan. What about others? Vasa vasorum includes. Actually, all of you, it's Saini, Shayani, Devnath, Murkeshan, Sri Rangaraj, all of you are right. It is a small blood vessel supplying the walls of large blood vessels. Vasa vasorum is important for providing nutrition to outermost layer of blood vessel, that is tunica adventitia or tunica externae. In case of tunica media also, if the vessel is very large, for nutrition. They are blood vessels of blood vessels. So, they are small blood vessels of large blood vessels. Now, see here in this diagram you can see this is the tunica adventitia layer in which small blood vessels which is residing is called as vasa vasorum. Vasa vasorum providing nutrition to outermost layer of the blood vessel, because with the diffusion of blood, the nutrients is passing through the blood, and via the process of diffusion it is not still possible to fulfill the demands of the outer layer of the blood vessels. So, absolutely correct, all of you, absolutely correct. Okay, so let's move on to the next MCQ, that is MCQ number 21. Let's move on to the next one. Question number 21. Reticular fibers of collagen tissue is present in all except. So, in which of the following reticular fibers? Namrata Agarwal, absolutely correct. Okay, so let's move on to, all of you will write question number 21 and then give me the answer. Okay, reticular fibers of collagen tissue is present in all except. Reticular fibers of collagen tissue is present in all except thymus, bone marrow, spleen, lymph node. 21A, Sri has given his answer. Biscake Dairies has given his answer. What about others? So, absolutely correct. Absolutely correct. Namrata Agarwal has given her answers. Thymus is the correct answer. So, can you tell me, in place of reticular fibers, which structure lies in the thymus gland? Can you tell me the name of structure in place of reticular fibers, which structure lies in the thymus gland? So, yes, all of you are absolutely correct. Just tell me one more answer. So, okay, Sri has given his answer and he is perfectly right that in place of reticular fibers, thymus contains epithelioreticular cells, endothelial reticulocytes. So, yes, epithelioreticular cells. I will write epithelioreticular cells. Epithelioreticular cells. Thymus gland has got Hazel corpuscles in the medulla part, but in place of reticular fibers they have got reticular cells. Rest or bone marrow, spleen, lymph node all will have reticular fibers. Actually, all lymphoid structures is having reticular fibers. Only thymus gland is not having reticular fibers. In place of reticular fibers, it is having epithelioreticular cells. The next important point is, can anybody tell me what is the function of epithelioreticular cells? It is forming one of an important layer. Can you tell me what is the function of epithelioreticular cells? It is forming very important layer. Epithelioreticular cells which is present in thymus gland is very important for forming one of the layer. What does it forms? It forms one of the important. It's absolutely correct, Sri, not worry. So, epithelioreticular cells of thymus gland is leading to formation of one important layer, and it is very important function of epithelioreticular cell. It is leading to the formation of BTB. Now, give me the answer. BTB. What is the full form of BTB? BTB. What is the full form of BTB? It is forming BTB. What is the full form of BTB? BTB, it is forming blood thymic barrier. It is forming the layer of blood thymic barrier. It is forming blood thymic barrier, and the function of blood thymic barrier is to inhibit the interaction of antigens of the blood to react with the immature T lymphocyte which is growing inside the thymus gland. So in the thymus gland there lies immature T lymphocyte. Immature T lymphocyte is growing, and if there is antigen reacting on this immature, antigen of blood will react with this immature T lymphocyte, there will be blood antigen reaction that is prevented by the formation of blood thymic barrier. Epithelio-reticular cell is forming blood thymic barrier. Let me show you this layer. So see here. In this diagram you can appreciate blood thymic layer. So this is blood thymic layer. Blood thymic layer is formed by endothelium. The endothelium is resting on basal lamina and epithelio-reticular cells. So see here, this is formed by capillary wall, perivascular connective tissue and epithelio-reticular cells. So all these layer, endothelium of the blood vessels, basal lamina, epithelio-reticular cells, here capillary wall which is consist of endothelium and basement membrane, also the connective tissue surrounding and epithelio-reticular cell layer. So all these three layers together is forming blood thymic barrier, which is very important in preventing interaction between immature T lymphocyte which is growing inside the thymus gland interacting with the blood antigen. So this is prevented by the presence of epithelio-reticular cells. So is the concept clear? Done? Okay. So my dear aspirants, so we have done with this. Now before ending the session, few important points I want to tell. One of the important point is that I am just going to start another session. So I am just going to start another session, that is the pectoral region. So I am going to start pectoral region conceptual topic. I am going to explain all the pectoral muscles, clavipectoral fascia in my next session, which I am starting from 8 p.m. on the Unacademy Future Doctor, on Unacademy Future Doctor platform YouTube. So those who are interested, link of the session is shared in the Telegram group of all Unacademy Let's Crack NEET PG Unacademy Telegram group. Via the link you can proceed and you can attend the session live, where I will explain all the pectoral muscles along with clavipectoral fascia. Okay, so this is 8 p.m. that is starting in another 20 minutes. Now my dear aspirants, before ending the session, let me give you the next session details. So high yield anatomy MCQ targeting for the NEET PG 22 examination. This session will be taken on Sunday. So I will take two sessions on the Sunday, that is 30th January 1 p.m. and 2 p.m. So all of you can join me live for this session. Thank you Shri, thank you so much. Thank you everyone for the nice participation. So I hope the session was useful for you. So you can attend the further upcoming session Let's Crack NEET PG YouTube channel. Few more sessions will be consecutively taken. So you can be present live. Tomorrow also I will take a session 3 p.m. and 6 p.m. on Let's Crack NEET PG YouTube channel. Do present live for the MCQ session. Now high yield anatomy MCQ session, this is on the Unacademy special class, and Unacademy app should be downloaded for attending the session live. Still, the students who have not downloaded the Unacademy app, please download it. Okay, find your goal as NEET PG. The student watching the session for the first time, they will use the code ANAT10 to unlock the session and be present live for the session. This is highly beneficial. Biscake Darius, thank you so much. Thank you so much everyone for a great participation. Now, this is the whole free test calendar which I want to show you. This is the whole free test calendar. This is the free test on the Unacademy platform. Avail the opportunity to be present in this free test and just revise all the concept of all 19 subjects. You can enroll in this test. All the free tests you can enroll by using the code ANAT10. Now, other than that, I want to give you an information of an important announcement, that is a great offer is going on the platform of Unacademy, that if you are going to take the subscription or planning to take the subscription, today is the last day. So today is the last day to avail the opportunity of 6-month free extension. So you can avail the opportunity of 6-month extension if you are going to take the plus subscription of 1 year and more. Okay, so you can also use my code ANAT10 to get an extra discount of 10%. So just avail this opportunity. This is highly beneficial, my dear aspirants. So an extra discount of 10% by using the code ANAT10, 6-month free extension as a Republic Day special offer. So just grab this opportunity. Also, before ending, I would like to show you this slide where the plus and the iconic comparison has been shown. So whether this will help you to decide whether you should go for plus or iconic. You can use my code NAT10 for an extra discount of 10% for both plus and iconic subscription. And before ending, now we will again meet in the next session 8 p.m. just now on the Future Doctors, where I will start the topic of pectoral region. Thank you. Subscribe. Do. Yeah, Murkeshan, thank you so much, dear. So do subscribe, like the channel, and let's meet tomorrow with the upcoming session on Let's Crack NEET PG, that is 3 p.m. and 6 p.m. session. Thank you so much. All the best. Keep studying. Thank you so much, my dear aspirants. Thank you.